Thank you, Brian. How good is this runway? Oh God, I'm just loving myself sick on that runway. So, before I start, I'd like to acknowledge the traditional owners of the land on which we meet today, the peoples of the Kulin Nation, and I pay my respects to their elders past and present. Today I've been asked to speak to you about the health workforce policy goals supported by the Nursing in Primary Healthcare program. In doing that, I want to start by saying a couple of other comments. The first one is that about 6 months ago, I also took over management of the Practice Nurse Incentive Program, so that's going to be of interest to some people in the room. And the other thing that started only a couple of weeks ago is the National Nursing and Midwifery Education Advisory Network, which is a high-level group which is providing strategic advice to all 9 health ministers on what we should be doing about education, immigration and other issues around nursing and midwifery. APNA has a seat at the table and you're represented by Karen Booth. And in mentioning APNA, what I want to say is I could not do the work that I do in the Department of Health if I didn't have a brilliant relationship with APNA. They're a fantastic organisation and they work so well with us. So, for those of you in the room who haven't yet joined up, there you are. And then the other thing is, I couldn't do my work without my team. Alison, are you in the room here somewhere? Where are you? There she is. That's Alison Simpson. Alison works on the Nursing in Primary Healthcare program and on the Practice Nurse Incentive program, and I couldn't do what I do without Alison. If you see her around, talk to her and tell her what your thoughts are about PNIP. All right, I've got 15 minutes. I understand, Brian. Tracy's left the room to do a nervous wee. So I'll see what I can do. Oh, no, I wouldn't dream of it. Okay, so now that's what you'd call a catchy title for a presentation. It's pretty catchy, yep, we all got that. APNA has been funded $6.4 million across 3 financial years to deliver a suite of activities under the Nursing in Primary Healthcare program. Now, there are 2 workforce policy goals which are supported by this program. The first is to build capacity among the primary healthcare nursing workforce by promoting the employment of and providing support to nurses working in primary healthcare settings. The second is to undertake reform and innovation in the primary healthcare nursing workforce to better address the primary healthcare needs of Australian communities. Now, you can hear more detail about the program this afternoon. I believe Bronwyn Morris-Donovan is doing a presentation, so I'd urge you to get along and find out a bit more about the program and how you can get involved. But I want to tell you a bit of a background of how we came to be doing this program, the why. You might be familiar with a document that was published in 2009, Primary Healthcare in Australia, a Nursing and Midwifery Consensus View. It was prepared by Amanda Adrian on behalf of the leading nursing and midwifery organisations, including APNA, and funding was provided by the Commonwealth Department of Health and Ageing. And the consensus view advocated for a shift of emphasis from the narrow perspective of hospital-based care to the promotion of health, the prevention of disease and injury, and the diminution of health inequities of all Australians across their lifespan. And I would suggest to you that nothing has changed. And in fact, nothing has changed since 1895. This is a poem called The Ambulance at the Bottom of the Cliff, written by Joseph Malins in 1895. And I'm sure many of you are familiar with this poem. It talks about looking at a problem backwards through trying to treat its consequences rather than its cause. It's almost about prevention is better than cure. So do you put a fence around the edge of the cliff to stop people falling over the cliff, or do you put an ambulance down in the valley to catch them when they've fallen? What I want to do today is look at the cliff. And in my mind, there are 2 cliffs. The first is the nursing workforce cliff, and the second is the health cliff, which is characterised by a rapidly rising demand for healthcare, driven by an ageing population, which is living longer with more complex and chronic conditions, including the rising cost of treatment and technology. So that's the healthcare cliff. We all know about that. That's your day-to-day work. Here's the workforce cliff. In a previous life, I worked at Health Workforce Australia, and we did some workforce modelling for nurses in this country. This is the result of some work that we did that was published in 2014. It's on the Department of Health website. I will give you the link to this later if one night you feel the need to cure your insomnia by some fairly in-depth reading material. So, Australia's Future Health Workforce Report looked at what the supply and demand for nurses in this country would be out to 2030. So the red line is the demand, which as you can see is steeply increasing. We come to the data that we use to look at demand is hospital separations and various other bits of data. And then you look at the blue line, which is supply, which is decreasing. The data that we use to get this supply comes primarily from the survey that you are all in the process of doing as you renew your registration. Yes, I love that. You are all doing the survey, yes. What we do, the other relationship we have is with the Nursing and Midwifery Board and with AHPRA. The survey is designed and it is owned by the Department of Health. We work with the jurisdictions, we work with the professional bodies, we work with the NMBA to work out what that survey should look like. It's administered by AHPRA, and then the data comes back to us. And what we do is we take the survey data that you complete and the registration data from AHPRA, and we come up with the National Health Workforce Data Set. And all of that data is then on the Department of Health website. So again, if you're suffering from insomnia and you feel like you want to do something, hop online, get hold of the tool and start doing your own workforce modelling. But the point of this exercise is to show you that massive gap between supply and demand. It's a huge shortfall of nurses that we're predicting. And although this work was published in 2014 with 2012 data, I have no reason to believe that this situation is any better now. So part of our workforce planning was to work out how we would close the gap. So here's some things. So if the red and blue lines look at a comparison scenario, like if we do absolutely nothing, this is what will happen. The green line there is what we can call constrained labour demand. And this means that you reduce demand. And we all know how demand gets reduced. Funding gets cut, beds get closed, you don't need so many nurses. The combined scenario looks at what you could do if you did several things. So what we did for the combined is we reduced that demand. We decreased the attrition rate for nurses in courses. The evidence we have is that the attrition rate for nurses in Bachelor of Nursing courses can be up to 34%. We've increased the employment rate of domestic graduates. So you know that for a few years recently, we've had a lot of newly graduated nurses who were unable to get into work and who are unable to get into work for a period of time. So we think if we can increase that employment rate. And then the retention, we've got a very high dropout rate of early career nurses. So if we work on that as well, then we can close that gap. But you will see there is still a gap there. And that, to my mind, is where things like the Nursing in Primary Healthcare program come into play. That's where we start to talk about innovative models of care, new roles, building the capacity of the workforce, people expanding their scope of practice. That's how we fill that gap. So how do you, as primary healthcare nurses, fit into this picture? There you are, that's you. This profile is done, again, using that data from the survey and the data from the National Health Workforce Data Set. As you will see, there hasn't been much growth. In fact, I'd suggest that that's probably what you'd call no growth, really, in the primary healthcare nursing workforce. The picture has remained the same for years. Now, bearing in mind that we've only got data going back a few years, but even so, that's not much growth. So we need to do something about this. If primary healthcare nurses are to play their part in closing that gap, we need to do something. And this is where the Nursing in Primary Healthcare program comes into play. So what activities are being funded? Many of you will know more about these activities than I do. There's a transition to practice pilot to support the transition of up to 50 newly graduated and existing nurses into primary healthcare settings. I'm very excited by this one because if we can demonstrate the career pathway for newly graduated nurses into primary healthcare, then I think that's a brilliant thing. And what we do is we can then link that through to one of the other pieces of work, which is the education and career framework. which will show people very clearly that this is an exciting and dynamic area in which you can carve out a wonderful career. The other thing that we're doing is a series of workshops in chronic disease management and healthy ageing, and a third of these workshops will be in rural and regional areas, because we really need to focus on rural and regional areas. The nursing workforce in rural areas is older than the rest of the country and ageing at a greater rate. And then the fourth thing is a reorientation of 8 healthy practice nursing demonstration projects. Now, these have been going for some years now, and they were funded recently under the Nursing and General Practice program. And these clinics demonstrate and trial really innovative models of care and show us what is possible. And as far as I know in my conversations with Bronwyn, what does 10 mean? Does that mean I've spoken for 10 or I've got 10 to go, Brian? I've spoken for 10? And I've got 10 to go. Oh God, that's great, isn't it? Because I only thought I had 15 minutes altogether. And I've got 7 slides, and I finished this presentation yesterday morning, and can I tell you, I had no idea how long it took. I still don't have any idea how long it'll take. But Brian will tell me. But the Healthy Practice Nursing Demonstration Project, so we had a meeting with Bronwyn and Dan the other day, 11 different pilot sites. We'd said 10, there was an 11th that they couldn't not have, it was so exciting. All around the country, all sorts of models of care. You know, this is the sorts of things that we can do. We showcase, we use exemplars. We can go to health ministers and say, this is what works, and this is what we need to do to build primary health nursing in this country. So I'm very excited about this. Did anyone else get that message that I'm very excited about this? I think it's absolutely brilliant. So I do urge you to find out more about it and get involved in it and see what you can do. I would also urge you, if you see Alison and I walking around the conference, probably Alison more than me, bail her up and talk to her about the Practice Nurse Incentive Program and tell her what you think that should look like as well, because she'd be very keen to hear what you have to say. So, let's talk about the ambulance, the fence, the cliff and the primary healthcare nurse. Sounds like the title of a film. How good is that ambulance? Oh my God, I want that ambulance. I want those so badly. So the poem finishes. Better guide well the young than reclaim them when old, for the voice of true wisdom is calling. To rescue the fallen is good, but 'tis best to prevent other people from falling. Better close up the source of temptation and crime than deliver from dungeon or galley. Better put a strong fence round the top of the cliff than an ambulance down in the valley. And I think that's what you're doing. That's the business that you're in as primary healthcare nurses, and that's absolutely brilliant. But before I finish, I just want to make one more comment, and that would be to speak about the quality of the fence. Because I think, looking at that fence, I think my comment would be, it would be better if the fence went right round the cliff, instead of stopping just short. And possibly if the fence had sort of a few more sort of like things in it, so that like toddlers couldn't crawl out through it and tumble down the cliff. So in saying that, all jokes aside, this is not just a numbers game. It's not just about getting nurses into primary healthcare. It's about making sure that the nurses we get into primary healthcare have the skills that we need them to have, that they are the right people that we need them to have so that they can deliver the best healthcare outcomes. So one of the big parts of the Nursing in Primary Healthcare program is an ongoing continuous evaluation. So part of the funding is for evaluation of that program, so that as we go along through the program, we know what's working, we know what's delivering really good health outcomes, and at the end of the program, we can be really clear about what we need to do next and where to from here. So I'd urge you to get involved, go along, hear what Bronwyn has to say. If you're not already a member of APNA, join APNA. What was my other key message? Do your survey. I love the survey. And Brian, you're going to love this. I'm done. Thank you.